Hey everybody, thanks for joining us. I'm Jillian with Moms for Mental Health, and also joining me are Cheryl and Brian, both mental health professionals. So let's go ahead and get started with some interviews. Cheryl, please introduce yourself and tell me a little bit about what you do.
Hi, I'm a psychologist in Annapolis, and I work with individuals and couples and do some group work. My specialties are mood disorders, anxiety disorders, eating disorders, and perinatal mental health while somebody's pregnant or after they have a baby.
Wonderful. Awesome. Okay, Brian, tell me a little bit about you and your practice as well.
Yes, my name is Brian Zimnitzky, and I'm an adult and a child psychiatrist, uh, where I treat the age ranges from probably 4 uh, all through the lifespan. And I do a combination of evaluations. I do therapy, both individual and family therapy, as well as evaluation for the need of medications for children and adults. And so I see a lot of children in my practice. I see a lot of people with anxiety, mood disorders, ADHD, and I also see a number of people with trauma as well.
Okay, great. Cheryl had mentioned you're a board-certified forensic psychiatrist. Can you tell me a little bit about what that means?
Yes. Well, that's the other half of my practice. So the one half of my practice that I just described is what I would say is the clinical half of my practice. The other part is forensic psychiatry. And basically what forensic psychiatry is the interaction between psychiatry and the legal system. So I get involved in criminal and civil matters where mental health is at issue.
Mm-hmm.
So for instance, in the criminal matter, it may be competency to stand trial, or what people would commonly refer to as insanity defense, giving recommendations for mental health treatment for somebody that might be undergoing sentencing for a crime. Sometimes I get involved in cases of whether a juvenile should be in the adult system or the juvenile system. And then the other half of it is my civil work, which basically is involved. A lot of that is involved in terms of when lawsuits arise and people have suffered emotional injuries. And in those type of cases, they get people like me involved, where I assess what has happened to them and relate it to what might be the legal case that's going forward in the court.
Okay, great. That's really interesting. So, I mean, in a way, you're serving a very vulnerable population there as well.
Yes, I am.
Wonderful. Cheryl, so I did want to talk a little bit. You introduced me to the coronavirus therapy kind of organization that was started to serve those on the front line of coronavirus. Can you tell me first a little bit about how that started?
Well, it actually was started prior to coronavirus by some folks we only came to know of after we were looking for a way to provide free therapy for folks on the front lines working with COVID.
Okay.
And the website, if people want it, is Coronavirus Online.
Great. We'll definitely link to that at the end of the video as well. Brian, can you tell me a little bit about your involvement with coronavirus therapy?
Well, I got involved. We had a group of us had heard of a mental health provider in the San Francisco Bay Area who was doing similar work, although not on this website. And we as a group had decided that we wanted to get together and to provide these services, but at the same time, we didn't really have the technical know-how or in order to kind of just set up a whole website from the ground up. So we were looking for opportunities where we could participate in terms of providing therapy for frontline people. And so we found we had looked at a number of websites where providers could volunteer their time, and that's how we found coronavirus online therapy. And so Cheryl, I, and some other providers have signed up for that in order to provide time-limited therapy at a significantly reduced cost or free of cost to those who are on the front line dealing with the effects of the coronavirus.
Wonderful. So you guys are basically kind of a fleet, part of a fleet of therapists nationwide who are available to offer free or low-cost services to those who
Yes.
are, working on the front lines of this pandemic. Great.
Yeah.
Correct.
Let's start with Cheryl again. How are you seeing coronavirus and the pandemic in general and social distancing, all of this kind of impacting the mental health of your clients and kind of citizens in general?
We are absolutely seeing an impact. Certainly increased stress, increased anxiety, especially for folks who may already have been struggling with an anxiety disorder. This sort of amps things up. Some depression, increased domestic violence and child abuse.
Mm.
And for the folks who are working on the front lines, often the trauma of doing that for docs, nurses, medical techs, the trauma of caring for people who are very, very ill and may not make it.
Right. Brian, do you have anything to add about what you're seeing in general with kind of this whole pandemic?
Well, I'll start with, there's another service that I have been involved with, which is physician support. I think it's called the Physician Support Network. I would have to double check on that.
Sure.
But what we are doing there is providing hotline services for physicians who are on the front line. And that's all staffed by psychiatrists. And it's a little bit different from the coronavirus online therapy where we're providing time-limited therapy. This is more of a hotline where one takes shifts. And in that, from doing that, I've been talking to various people who are on the front line, who are working in intensive care units, who are seeing a lot of sick people. And with that, there is the stress of all the trauma they're seeing, plus the added stress of protecting themselves and their family. And a lot of these people are very worried about, I don't want to come home and accidentally make my family sick because of the work that I'm doing. And that's very stressful for them.
Especially when there may not be adequate PPE.
Yes. That would be protective equipment in terms.
Sorry. Yes.
So so I'm seeing that. I've been through the coronavirus therapy. I've been doing some therapy with someone who's working in a hospital and who's presenting with a lot of anxiety around the fact of what he is dealing with on the front line and the concerns of, and the concerns of protecting himself and his family at the same time.
Yeah.
In terms of my private practice, I'm seeing most people are basically on lockdown and staying home. And that's, for some people, they're doing pretty well given the circumstances. For other people, it's very, very stressful. One of the things that's important to note is that when someone's under stress, they're often reaching out to others and they're reaching out to their friends and their family. And under this circumstance, because of the physical distancing that we have to do, we're making it more difficult to provide that support for them. In order to try to keep things safe. So that's making it more stressful for people.
I think it's also an interesting point where you say usually when people are under stress or a circumstance they're having difficulty dealing with, they reach out to friends and family, but usually your friends and family aren't also suffering at the same time. So yeah, that's a very interesting kind of conflict there, is the people we usually rely on to lift us up and say it's going to get better are all kind of dealing with the same stress.
Yes, and different people are reacting in different ways. And I think that there's this way that we, as a community, one's friends or family may be able to, they are supporting each other. And there might be times where one person might be doing better than the other and offering support, and there's other times it may flip the other way. So we are all dealing with the coronavirus at different times. Each of us may be doing better than at other times, and so it's important that we try to support each other as a community.
Right. Cheryl, would you say that it's more important now than ever for people to really take the time to address their mental health needs, and understanding that these feelings of like anxiety or depression or isolation are very valid, and they do need to actually reach out and get support for what they're dealing with?
Absolutely, absolutely, and the support is there. Yeah, I think, folks are at increased risk of depression, of anxiety, of all sorts of things, and it's crucial to reach out for support, and if you need it, for treatment.
Wonderful. And Brian, would you say that you see any kind of long-term effects or long-term changes to the way mental health is addressed after something like this?
Well, I think that there's going to be an increased need for mental health services. I think that this is going to be a traumatic for a vast number of people, and I think there is going to be an increased need for services. Part of the challenge is trying to meet all those needs, and then under this current circumstances, which makes it more difficult because of the physical distancing, is how those services are provided. Right now, for most people, because of the contagiousness of this virus, most people are providing services online.
Mm-hmm.
The last thing that people want to do is, when we're trying to address people's mental health needs, we don't want anyone to get into an unsafe situation. So we're trying to, most providers have opted that the safest way of providing this is providing this online. In some ways, it is easier for mental health professionals to provide services online, rather than if you needed to see the surgeon or something, where one has to have a physical exam, and maybe there are other things that mental health does lend itself, that I have found, a little bit more easily to being able to provide services online.
Right. I've actually even heard of a few people say, especially people through Moms for Mental Health, that they've been putting off therapy so long, and then finally, once telehealth became like an option right now, they actually jumped right in and they've been loving it. So in some way, it's almost helped some people start to kind of get the help they need, because they don't have to be physically present for therapy.
Yes.
Well, and I think that it's also offered some benefit. Certainly there's parts of it that don't feel quite as comfortable as when you're in the same room. But at the same time, for instance, when I talk to the teenagers that I'm seeing, they'll show me their room. They'll show me what art projects they're working on.
Yep.
They'll show me their pets. So in a way, I'm getting a window into their lives that I wouldn't have otherwise,
Yes.
which is helpful.
I've met a lot of pets.
That's so funny. Yeah, my kids are obviously doing homeschool right now, and sometimes I have to, when they're on like a Zoom chat with school, I'm like, okay, bring it back. They don't need a tour of our basement. Come on. So, well, there's always positives and negatives of every aspect. Then, are there any words of advice either of you have for either frontline workers or just the average citizen, kind of during this difficult time?
Don't hesitate to reach out. I think that sitting, especially with the pandemic, with the lockdown, if you are starting to feel stressed or anxious or depressed, not to hesitate to reach out. That there, in addition to family, friends, there's a whole professional
Sorry.
that we're out there to help. And the sooner you reach out, the sooner you can start working on things getting better.
Yeah, I would absolutely echo that, and encourage folks to come in sooner before things really get to a crisis point.
Right. It's always easier to address things, when they're moderate rather than overwhelming.
Yes.
If you're thinking about it, it's probably a good idea to reach out and make a phone call.
I agree. I agree. Any other points you both would like to, either of you would like to make? Oh, is that a dog? Hi,
That's
doggy.
Ginger. She is actually a therapy dog. And when we're in the office, she's with me.
Oh, wonderful. Awesome. So I'm sorry. Any other points either of you would like to make?
I would just say that this is a stressful situation for everybody.
Yes.
And not to hesitate to, what I would say is not to hesitate to reach out and not to look at it as a sign of weakness if you
No.
need help. Because a lot of people are under stress and we are all needing to depend on each other. So if you feel like that, things are really tough right now and you feel like you need some assistance, not to hesitate to reach out.
Wonderful. Awesome.
Yes.
Well, thank you both, Dr. Brian Zimnitzky and Dr. Cheryl Rubenstein. Thank you both so much for offering your insight.
Thank you.
And thank you for offering, your services for those on the front line. I think that's really important.
Glad to do it.
I will link to both of your websites as well as the services you both mentioned, so we can make sure that people are getting all of the care and the support they need.
All right. Thank you.
You're welcome.